Irregular menstruation is more common than what it seems to be. We often come across that the normal length of the menstrual cycle is 28 days and that the menstrual flow should last from 3 to 5 days. However, the reality is far from this. More than 80% of the women report having irregular periods or period problems at some point in their reproductive years. Ayurveda offers effective natural solutions to regulate your menstrual cycle, to balance your hormones, and to boost your fertility. Hi, this is Nidhi Bansal here from Medhya Herbals. We help women to gain health with all natural and holistic principles of Ayurveda. And in this video, I will share with you the causes and symptoms of irregular periods and what can you do from Ayurvedic holistic perspective to regulate your menstrual cycle and get rid of the problems of irregular periods at the root cause level. Let's get started. Now, irregular periods are a common occurrence during early years of menarche in adolescence and during the perimenopausal years of menopause. This is because the reproductive hormones estrogen and progesterone are not really flowing in a regular manner at both ends of the reproductive life of a woman. However, if one is struggling with extremely irregular periods such that they are too short a menstrual cycle or the periods that don't show up, then it's surely an indication of hormonal imbalances that need to be addressed to provide further complications such as infertility and inflammatory disorders such as PCOS, Adenomyosis, Endometriosis and Fibroids. Here are some of the factors that cause hormonal imbalances which eventually trigger menstrual irregularity in women. Number one is nutritional deficiencies such as zinc, vitamin D, calcium, magnesium, iron and folic acid which affect the flow of hormones in a regular menstrual cycle. There are also the nutritional deficiencies which are highly prevalent in women who have PCOS or endometriosis. That's why it is really important to make sure that you are getting sufficient nutrients such as important vitamins and minerals through your diet or through herbal supplements. Second factor which can affect your menstrual cycle is insufficient proteins or healthy fats in your diet. Both of these are the core building blocks of the hormones estrogen and progesterone which regulate your menstrual cycle. When you are not getting sufficient proteins or healthy fats in your diet or you are pursuing a poor diet and lifestyle, then it severely affects the quality and the quantity of both estrogen and progesterone in your body. Thus, they are not being generated in sufficient quantity, as a result of which the menstrual cycle will be affected. The third factor which affects your menstrual cycle is level of stress and your mental health. When you are undergoing periods of stress or emotional turbulence, then it increases the level of cortisol in your body, which further affects the levels of estrogen in your body. Additionally, cortisol can also boost production of androgens from your adrenals as well as your ovaries, as a result of which you may struggle with high levels of male hormones, which happens in cases of PCOS, which further suppresses your menstrual cycle. High levels of androgen can also cause other problems such as facial hair, acne, and also hair loss on the scalp. The fourth factor which affects your menstrual cycle is your sleeping pattern. When you are not getting sufficient sleep in the night, then it affects the level of melatonin in your body, which regulates the flow of hormones throughout the menstrual cycle. When there is insufficient melatonin, that it also affects your sleep quality and the hours of sleep that you will be able to clock in, which leads to a vicious cycle of sleep problems, hence lower levels of melatonin and hence insufficient estrogen and progesterone, which leads to irregular periods. The fifth factor that can lead to period problems is changes in weight. When you experience extreme changes such as high amount of weight loss or extreme weight gain, more than 3 to 5 kg in general, then it can severely affect your menstrual cycle because weight is really related to the amount of fatty tissues in your body. When you lose them at a very fast rate or you gain them at a very fast rate, then it affects essential source of estrogen in your body because estrogen is also produced through fatty tissues in your body. Extreme changes in weight creates additional physical and mental stress to you, which further affects the level of estrogen and progesterone, thus affecting your menstrual cycle. That's why it is very common for women who experience extreme weight in PCOS to have irregular periods or absent periods. It is also common for women very lean to experience period problems or periods that don't show up. The sixth factor that affects your menstrual cycle is exposure to external sources of hormones, either through hormonal pills or through endocrine disrupting chemicals. All of these hormones disrupt your regular flow of hormones in the body, which further affects your menstrual cycle. Hormonal pills essentially suppress your regular body functions such as ovulation and hence menstruation, which is a key reason that you don't experience regular periods after you stop taking these pills. Some of the other factors that affect your menstrual cycle are explicit hormonal imbalances, as one experiences in thyroid disorders or PCOS or endometriosis. All of these health conditions are arising as a result of imbalance in the levels of estrogen, progesterone, thyroid, and prolactin, the important hormones which are controlling your overall physical and mental health, as well as the health of your reproductive system and your fertility. Whenever there is such kind of hormonal imbalance, it is imminent that it is going to affect your menstrual cycle also. Now that you have a better understanding of the causes of irregular periods and period problems, let's look into some of the symptoms that you may experience as a result of these hormonal imbalances. Irregular periods can happen in multiple ways, such as the periods that don't show up. It is also called amenorrhea. There can be primary amenorrhea or secondary amenorrhea depending on the health of an individual. Primary amenorrhea happens basically in absence of any specific health condition, and secondary amenorrhea is as a result of health conditions such as pituitary disorder or any kind of explicit disorders which one is experiencing. The second way in which you may experience irregular periods is through the extreme length of your menstrual cycle. When your menstrual cycle is longer than 35 days or your periods are not showing up often, for example, you may have one cycle in every 3 months or 4 months, that is called oligomenorrhea, in which the periods are infrequent and irregular. This also affects the levels of hormones in your body. Either you may have estrogen building up and you may experience extremely low levels of progesterone, which also becomes evident in other symptoms that you experience in terms of the quality of your skin, hair, as well as your mood and general well-being. The third way in which you may experience irregular periods is cycles that are very short and the periods that come too often. In this case, you may have heavy bleeding as well, or you may have cycles that are coming too often, cycles that are shorter than 20 days. The fourth way in which you may experience irregular periods is called scanty periods or hypomenorrhea. In this case, the menstrual flow is not sufficient. You may be experiencing extremely dark, frothy and scanty flow, which is just like spotting, which happens for a few days and then it goes away. You may experience spotting in between the cycles, which is also infrequent. So basically there is kind of no pattern, or there may be just scanty periods that you are experiencing as a result of the hormonal imbalances. Another way in which you may experience irregular periods is heavy bleeding during your regular menstrual cycle. So the cycle is regular, but the bleeding is extremely heavy or it is extremely prolonged. That is, it lasts for more than 7 days. Another period problem that you can experience as a result of the hormonal imbalances is extreme pain, menstrual cramps or PMS symptoms that make your life miserable during the periods. You really dread periods because of the discomfort and pain that you are experiencing. You may also experience spotting in between the periods. As I said, this can happen in any of these cases because the flow of hormones is not regular. So there is no kind of defined pattern that your periods may be following. Whenever there is changes in level of estrogen as a result of change in other hormones in your body, you may experience some kind of spotting, or you may experience extreme pain and menstrual cramps. In Ayurveda, menstrual cycle is considered to be part of your monthly cleansing or detoxification, which happens in a natural way. Menstrual blood is a waste product that is formed after the blood tissues or the Rakta Dhatu is generated from the Rasa Dhatu or the plasma tissues. Thus, menstrual cycle allows you to get rid of this waste product in the form of unwanted materials, toxins and malignant blood tissues that need to be removed from the body. That's why menstruation is considered to be a time to rejuvenate, to relax and to nurture your mind and body through a good diet and lifestyle. Regular menstrual cycle is essential to maintain the balance of the dosha of the hormones and of the health of the reproductive system organs. Healthy menstrual cycle is also an indicator of fertility and vitality in women. Basically, your menstrual cycle is an indicator of your overall health, of your physical and mental balance. Disturbance of menstrual cycle is kind of a symptom of what is going on inside. That's why Ayurvedic treatment really emphasizes on taking care of the body by providing it the essential nutrients as well as the care that it needs to maintain the balance of the dosha, of the hormones, and hence the flow of your menstrual cycle. Healthy natural periods also help women work better with their fertility window and hence experience healthy pregnancy outcomes. On the other hand, irregular periods, period problems such as pain or heavy bleeding during menstruation really make your life miserable and make it difficult for you to function on a daily basis as well. Ayurvedic treatment for irregular menses really focuses on balancing the hormones and restoring the fertility in women. With the help of Ayurvedic herbs, a nourishing diet and lifestyle measures, you can really balance your hormones, boost your fertility, improve your egg quality, regulate the quantity and the quality of the hormones that are flowing and hence your menstrual cycle, and prevent the problem of irregular periods and other health symptoms that accompany irregular periods. Now let's look into Ayurvedic natural measures that you can employ to balance your menstrual cycle and hence get rid of the problems of irregular periods. The first thing that you can do is to have a healthy and nourishing diet, especially during your menstrual cycle. You should have a light and easy to digest diet because it is essentially a time of detoxification, so you should support that natural detoxification. And during the rest of the menstrual cycle, your focus should be on balancing your hormones by providing your body with essential nutrients such as zinc, iron, magnesium, calcium, and all the essential B vitamins that are required to form healthy hormones. In addition, you should also take sufficient amount of proteins and healthy fats in your diet so that you are building quality hormones and also they are flowing in a proper manner. When you take a nourishing diet, avoid all kind of foods such as processed foods, heavy to digest foods, fried, spicy, sugary snacks, which are really affecting the balance of your hormones. Then you will find that the hormones are getting balanced. Your body is getting rid of all those toxins that are essentially hampering your menstrual cycle and creating a lot of inflammation in the body. So start with the easiest and the most important step of balancing your diet to regulate your menstrual cycle. The second thing that you can do to regulate your menstrual cycle is to have a good night's sleep every night. As I said, sleep is the time when your body is producing melatonin naturally, and when you are catching that good night's sleep, you are balancing melatonin in your body. You are regulating your sleep cycle and your circadian rhythms, which will further affect the flow of hormones in your body in a regular manner. And when that happens, then you will have a regular menstrual cycle too. The third thing that you can do to help your menstrual cycle is to regulate your weight. If you are underweight, try to have a balanced diet and then follow a nourishing lifestyle so that you are able to reach a healthy BMI. And if you are overweight, you should follow a healthy lifestyle which will help you to cut on all the sources which are leading to weight problems. As a result, disturbance in your hormone balance and hence disturbance in your menstrual cycle. The fourth thing that you can do is to take support of Ayurvedic herbal supplements. Ayurvedic herbs are potent anti-inflammatory agents. They help to detoxify the body and get rid of all the toxins and unwanted hormones that are creating hormonal imbalances. They also help to balance the hormones by supporting your body's endocrine organs such as the ovaries, the adrenals, the pituitary gland and the thyroid gland. Thus, they help to improve the flow of hormones and also help to increase the quantity of good hormones in your body. Ayurvedic herbs also help to improve the quality of egg and hence boost the fertility in women. Different Ayurvedic herbs act on different body tissues. Thus, based on your health requirements, your Ayurvedic doctor will prescribe set of medicines that will be right for your body constitution, and your Ayurvedic doctor will also set a routine for you to take these herbals so that you are able to balance your hormones and thus balance your menstrual cycle. The next thing that you can do to regulate your menstrual cycle is to practice yoga and pranayama. These are powerful tools to balance your hormones. If you are experiencing any specific health conditions such as PCOS, endometriosis, fibroids or cysts which are really preventing the flow of hormones in your body, then there are specific yogas and then you can practice according to your health condition, which will help you to balance your hormones, boost your metabolism, hence regulate your menstrual cycle. In addition, yoga and and pranayama also help to improve the circulation in the body, provide your body with a vital force, the prana, which increases ojas, supporting your vitality and fertility. If you find it difficult to include yoga and pranayama in your daily life, then start with deep breathing exercises that you can practice at any time. Whenever you get a chance, you can essentially do deep breathing when you are working as well. If you are a working professional, studying, or a busy mother, then that will help you to really relax, calm down, and provide the essential life force, the oxygen, which will also improve the circulation in the body, as I said. So start today. Last but not least, you should get rid of all the stimulating factors such as alcohol, caffeine, smoking, which are really debilitating for your hormones. They also affect the dosha balance such as the pitta dosha and vata dosha, which are essential for the generation of the hormones as well as the flow of hormones in your body. Thus, when you are pursuing a healthy lifestyle and preventing all the causative factors that lead to imbalance in hormones, you are essentially giving your body what it needs, the right conditions and the right raw materials to generate the hormones, to make the hormones flow in a regular way and hence regulate your menstrual cycle on every cycle basis. Now, the most important thing for you to do is to start. It is difficult to begin, but that's the most important step. When you take that first step, you are really charting out the whole journey of balancing your hormones, of transforming your health, reaching your health goals, whether it is just to balance your hormones to get rid of the period problems that you are experiencing or to boost your fertility and experience healthy pregnancy outcome that you are really looking forward to. Now, do leave your comments, suggestions and feedback. I'll get back to you. I do reply to every comment that you leave. Do subscribe to the channel because that way you will be updated with more health tips that will help you to balance your health with Ayurveda. Do like and share this video with your friends who may find it useful too. I will see you soon in the next video. Until then, bye.